Select stock tray that will cover all landmarks indicating the denture-bearing areas. Also check the impression tray and make sure it covers the retromolar pad, external oblique ridge, and mylohyoid ridge. Any deficient area should be corrected by utility wax. The wax should be used on the posterior lingual borders and retromolar pad to carry the alginate into the lingual sulcus. Then load it into the stock tray. Stand in front of the patient and place the tray at the left corner of the mouth. The right corner of the mouth is reflected with a mouth mirror. Center the tray over the residual ridge so that the tray handle is in alignment with the median line of the face. At this time, the lip is pulled out so the alginate flows into the labial sulcus. The seating pressure is stopped, the border molding is performed so that the impression is not overextended. The tray is held in place until the alginate has completely set. Remove the impression from the mouth. Inspect the impression to determine if it's acceptable. Soften one end of the green stick compound slowly over the alcohol torch. Add compound to the border of the tray from the right buccal frenum to the right retromolar pad. Flame and temper. Reflect the cheek with the mouth mirror and seat the tray. Grasp the cheek at the corner of the mouth and draw outward and upward. Massage inward, forward, and backward. Remove the tray, chill it in ice water, and inspect. Place the compound along the anterior border of the dried tray from the buccal frenum of one side to the buccal frenum of the opposite side. Flame. Temper the compound by placing it briefly in a 140° Fahrenheit water bath. Reflect the cheek with the mouth mirror and rotate the tray into the patient's mouth. Position the tray and seat it in the patient's mouth. Draw the lower lip gently outward, upward, and inward. When set, remove the tray, examine the border, and chill in ice water. Place green stick compound on the right distolingual border from the end of the border molded area to the right retromolar pad. Shape with wet fingers and seat. Ask the patient to place the tongue tip back and up as far back as possible. Next, have them evaluate the stability of the border molded mandibular tray with the tongue at rest. Place equal 4-inch length of light body rubber base catalyst and base on the mixing pad. Mix until homogeneous. Distribute the material uniformly in the tray using a small cement spatula. Cover the borders 2 to 3 mm onto the labial and buccal surface of the tray. Remove the gauze from the patient's mouth. Standing to the right of and in front of the patient, reflect the patient's cheek with a mouth mirror and rotate the tray into the patient's mouth. Instruct the patient to open his or her mouth widely and lightly protrude the tongue and lick the upper lip from one corner to the other. Hold it in position with the index and forefinger with enough pressure to keep the tray seated. The vestibular tissues may be briefly and lightly border molded for about 30 seconds after the tray has been seated. Allow the material to set Remove the final impression. Inspect the impression to determine if it's acceptable.